This episode of the podcast was brought to you by Dermatonic Skincare. Welcome to today's episode of the Beauty Industry Podcast, connecting you with educational pieces, innovative industry products, and inspiration from industry experts. I am your host, founding director of Beauty Industry, Tamara Shaw. Today we are diving into the world of plastic surgery, to which I am thrilled to bring to your ears Dr. Jack Zoumaras from Artiste Plastic Surgery. I first met Dr. Jack on a networking boat cruise on the Sydney Harbour in 2017, where he was presenting for a group of Ali Lucas graduates, providing insight into the world of plastic, and I was hooked. Rudely during his talk, I wanted to know who I was listening to, and as such got out my phone and started scrolling through the Artiste Plastic Surgery Instagram page. Here I saw Dr. Jack's before and after photos. Seeing the results of his work firsthand and noticing his 14 years of experience, I further turned my phone off and listened to his inspirational career and journey through the beauty industry. Jack Zoumaras' passion is aesthetic and reconstructive surgery of the face and is a facelift expert after working with world leaders in facelifts in New York and Paris during his post-fellowship training. An absolute wealth of knowledge and an expert in his field, and also a joy to speak with for our first episode on plastic surgery. Today, from Artiste Plastic Surgery, we welcome Dr. Jack Zoumaras.
Thank you. Thanks for having me, Tamara.
Our absolute pleasure. We're so excited to have you. You could see our audience on our Instagram was 100% heck yes, get Dr. Jack on the podcast.
Awesome. Love it. Love it.
You are obviously a plastic surgeon. Take us back to the very start of your career. What was your driving force behind wanting to study medicine?
Oh, that's a good question. And it's probably like a very long-winded answer as well, but I'll try and keep it brief. But I've always wanted to be a doctor from when I was probably as young as I can remember, really. Like, I don't know if it was as young as 3, but definitely 5 years old. And the reasons why I wanted to be a doctor is I used to like going to my GP when I was ill, or maybe I cut myself, and I used to like the fact that the GP used to obviously treat me, used to comfort me, and I really liked that feeling. I felt so good after seeing the doctor, even though it was a bit scary going to the doctor in the beginning. And I always thought, I want to be a doctor when I grow up because I want to help people. And I also remember one vivid image of my doctor giving me an immunization, and it hurt like hell in my arm, and I said to him, quite aggressively, as a 5 or 6 year old, I'm going to come back one day, be a doctor, and inject you. But I didn't manage to do that. But so that's what my driving force was. I never really considered anything else in my career from that age. Even in primary school, I was thinking about what to do in year 12 to get into medical school. So then obviously I got into medical school and became a doctor, which was great. And then the next step was to work out what I wanted to do.
Fantastic. It's so nice to hear that you've stuck with that dream. When I was in primary school, I wanted to be two completely opposite ventures in life. I wanted to be either a lawyer or an artist.
Wow.
And I did neither of those.
There you go.
From medicine, how come plastic surgery? What drew you to that field?
Yeah, so I never really considered plastic surgery until halfway through my medical training, and never really then was certain about at the end of medical school. So basically, in the first couple of years of medical school, I wanted to be, initially, obviously, before I got into medicine, as I told you with that story, I wanted to just be a GP. But then when I started medical school, as I was getting into medical school, because I did undergraduate health sciences, my dad had a cardiac bypass, and I was kind of interested in the heart. And cardiology was the area that I was pushing towards. And I liked the anatomy of the heart, physiology of the heart, atherosclerosis, blood pressure, all of these mechanical things. And I wanted to actually be a cardiologist. And then I thought to myself, but I kind of want to do surgery though. I want to do something with my hands. Because when I was a child, I used to like pulling things apart. Like, for example, I used to like like love just using a screwdriver and pulling apart my toys. I used to love my old radios, pull them apart, put them back together. So I used to like doing things with my hands. So I kind of wanted to do like cardiology, but then I wanted to do surgery. So I was a bit confused because at the time you could either be a physician, which is basically a cardiologist, or a gastroenterologist, or you're a surgeon. So I was kind of umming and ahhing whether to do cardiology or heart surgery. And then I got some exposure accidentally to plastic surgery for about 2 weeks only. And I thought, and it just blew my mind. It was just like, all of a sudden we're doing a skin graft, and then we're doing some lab-based experiments, then some cosmetic surgery, and then major reconstruction. I thought, wow, this is just so varied. And then, like, you know, it was kind of on the back burner. So I was either, maybe plastic surgery or maybe cardiac surgery. And then in the final year of medical school, I was lucky enough, based on my grades, to do an exchange with Columbia University in New York, which is an Ivy League school. So I exchanged for, I think it was 12 weeks. I went to New York, and I think the only rotations left were something like immunology and plastic surgery. And I'm like, yeah, I'll do plastic surgery because I had that interest 2 years ago. So I did my rotation in plastic surgery in Columbia University, and then it just solidified the what I wanted to do. And plastic surgery just interested me because of the variety of work, the fact that you can physically see the work you do, whether it's reconstruction of cosmetic, like whether there's burn surgery, or whether it's reconstructive or cosmetic face or breast and body. The actual results are visible to everyone. So there's like that pressure, but also that instant gratification of the work that you do. So I think probably the moment was when I was in New York. Then I just thought, yeah, I want to be a plastic surgeon.
Incredible. So it's the combination of the love of the general practice, the need and the want of the tinkering and being kinetic, and then finding your passion through plastic surgery.
I think that's exactly what it is. And you know what? You're the only one that's articulated it that way, but that's probably exactly what it is.
Fantastic. Now, can you share with with all of us, some of the qualifications you need to be a plastic surgeon? Because as you've said there, you've been to New York, you've already studied GP and general medicine. What is the pathway for somebody who is looking at medicine who wants to progress a little further?
Yeah, well, look, good question. I mean, first of all, like, to do anything in medicine, you have to have a medical degree. So you've got to get into medicine. Like with medicine, you can either enter medicine from high school, and there's a few courses from high school, and that's usually a 6-year course. Otherwise, there's postgraduate courses, and that's the majority of medical schools in the world in Australia now. So you do an undergraduate, what we call pre-med, of 3 or 4 years, and then you do an exam and then do graduate medicine, which is 4 years. So you're averaging 6 or 8 years to become a doctor, or at least a medical doctor, after high school. And then after that, you do 1 year of internship. Everyone has to do that. And then after that, you can choose what sort of area you want to go into. And if you're unsure, you can still do what we call general residency, where you're doing a bit of everything until you decide. And to be a surgeon, you have to do surgical training. And that surgical training is anywhere between 5 and 7 years, depending on the type of surgery. And plastic surgery, I think now is about 6 years. So the quickest time to be a plastic surgeon from high school would be 8 medical school years plus 6, so 14 years from medical school. If you were to be a physician, say like a dermatologist or a GP is 3 years after internship. A dermatologist would be, say, 4 years after internship. So to put it in perspective, most surgeons have done at least 14 years after medical school. So to do plastic surgery specifically, you need to do a 6-year plastic surgery specialist training after internship, which is competitive to get into. You might get into it right away. It might take 4 years just to get into. So it could end up taking 20 years.
So you truly have to be on a pathway where you are aligned with, because 14 years of study is not taken lightly.
Well, that's exactly right.
Do you have a specific passion for education and learning? Is that a thrive for you?
I think you have to have that energy for learning. And like you said, because it takes so long, there's a lot of people that do drop out of surgical training for that exact reason. Because basically, you're not till you're in your mid to late 30s before you're basically a fully fledged surgeon starting your career. Do you know what I mean? Compared to a lot of other professionals. So you do have to stick at it a long time. And you have to enjoy the education and the learning. And obviously you get paid while you do it, but it's a different sort of level when you've got to do exams and things. But I would say absolutely, because now that I've, successfully became a plastic surgeon, fortunate enough to travel to New York and Paris to do fellowship and open up my own practice and got a Medi Spa. I've actually in the process of launching another educational business for doctors on business. So I've always had a passion for education. So you kind of definitely have to have a passion for education for to hang out for 14 years.
Yeah, yeah, exactly right. Describe for me, you mentioned there your time in New York. You've also traveled to places like Paris and Europe specifically. What does the industry look like over there, and how was that experience for you being in a foreign land and studying?
Yeah, it was a great experience. Like the New York experience, obviously, from a language point of view, was really easy. In Europe, the language was obviously very difficult because I had to learn French, and not only French, but also medical French. I had to write operation reports in French on a keyboard. Like if you've ever been to Europe, the keyboard in France is very different to an Australian keyboard, even though the letters are the same. The A, the W, the S are all in different places. So you kind of have to learn a whole new skill. But from a industry point of view, they're very different. Like America is very cutting edge, but at the same time, because America is such a big, broad place, there's a lot of people coming in and out of America from overseas for surgery. There's a lot of South Americans training in America. So I'd say the overall standard of plastic surgery in America is probably slightly lower than Australia in terms of the standard of training, because Australia's a small place. You can actually really fine-tune the training. But having said that, the top end of America is very high. So it's a lot higher than us. So the best, what I think are the best surgeons that I've seen have been in America. And certainly in New York. So New York is a place where they do a lot of facial plastic surgery, and that's what drew me there because of my interest in the face. And they essentially, it's a fast-paced city. So most of the operations that they do in North America, especially New York, would be short scar facelift, things like that don't take as long because patients want a quicker recovery. The surgeon doesn't want to spend the whole day operating on one face; they want to do two faces. As opposed to the west of America, where I was in San Francisco, where it was a little bit slower pace, kind of more like beach lifestyle, and they'll do one facelift a day, a longer facelift, and the patients weren't quite in a rush. And then you contrast that with, and that was the choice. The choice was given to the patients in North America, and as I said, it was very cutting edge in terms of what they're doing, and they've basically revolutionized all the anatomy as well. With regards to Europe was very paternalistic in terms of medicine. It was like, doctor knows best what you want. So you'd come in, the patient would come in, it would be like 5 or 10 minute consultation only versus an hour, what we do here in Australia. And it's like, yep, you're going to have a facelift, you're going to have eyelid surgery, and we're just going to do it. You get no choice in what we're going to do, and it just happens. So France was very different that way. And the aesthetic in France was definitely more understated. So even though there's a famous French book saying French women don't get plastic surgery, that is so not true, because they actually the Americans, or actually the statistics, the International Society statistics show that France has I think they're in the top 10 countries of having plastic surgery in the world. So they actually definitely have a lot of plastic surgery. It's just more underdone. Whereas in America, I would say in New York, it's more facial. In California, it's more breast and body. So it was definitely a nice contrast to see. And to try and fit there as an Australian trainee was really good because you get a blend of both sort of ethoses or both sort of approaches to plastic surgery.
Yeah, fantastic. And it kind of that different contrast between kind of the European and the New York, you can almost see that in looking at the landscape as well of the people and the faces. You can see the Parisians do look a little bit more relaxed or a little bit undone, if you can call it. Yeah. Whereas in New York, they're wanting a specific trend look at the time, aren't they?
Absolutely. And that is so true. And it's so true with rhinoplasty nose surgery, because there was a time in New York, a lot of the old professors told me when I was there 6 years ago now. Geez, was it 6 years ago? Yeah, it was 6 years ago. Yeah, the old professors were saying that everyone used to get a diamond tip nose in New York. So everyone in the 90s had the same tip rhinoplasty, which is just crazy. That was the trend. And obviously, that's not the case now. And because of that contrast, like you mentioned and I alluded to, and that's why on my facelift menu, I offer a variety of facelifts. So, I've got an ultimate face neck lift, which pretty much is an ultimate rejuvenation. You'll see a difference and you'll look a lot younger and fresher. And then we've got the more subtle short scar or signature facelift that will make you look less tired, but not necessarily look overdone, or people won't even know you've had something done. And patients often say it looks good, but I sometimes maybe wanted more, or patients see it, I want a little bit more. So I offer that spectrum of facelift pretty much to reflect the training that I've had.
Fantastic. A facelift menu. Now, we've been talking with spa therapists and beauty therapists about their treatment menu, and this is a whole nother level. You've got a whole menu for a face.
I know. I reckon I'm one of the only plastic surgeons in Australia to have a facelift menu, because I'm so passionate about it. I do actually have a facelift menu, and that's exactly what I call it.
I love it. And you would have to, because I read in 2013 you had performed over 5,000 procedures. In 2019, 6 years later, what is that number looking like now?
Wow, that's like that number was probably my whole like training leading up to that time. From 2013, you know what? That is a great question. I don't know the answer to that question, but I would have at least doubled that, because obviously being a plastic surgeon on your own since then, I've been a lot busier. So I probably would say I would have doubled that for sure. But what's probably more interesting is if you look at the breakdown of what I'm doing, is probably up to 2013, I was probably equally doing, you know, a lot of cosmetic surgery of the face, breast and body, and reconstruction of the face, breast and body. Whereas probably now I'm probably doing 90% cosmetic, and of that cosmetic, probably the majority of the face, and of the face specifically facelift and rhinoplasty. So that's where the breakdown's a lot different compared to 6 years ago.
Fantastic. So ballpark 10,000 plus treatments.
I'll say probably since I started, definitely.
Yeah.
That's probably, yeah. And it's probably underestimating it a little bit, definitely.
What does a typical day in the life of a plastic surgeon look like?
Yeah, so if it's a consultation day, what it does is I usually start my consultations, which is seeing patients in my office, from 9 o'clock in the morning. So prior to that, obviously get up, have breakfast, spend some time with the family. Then what I do is I usually go to the hospital from the operating the day before to check the patients, make sure they're okay. I usually do that about 8 o'clock in the morning. Then I get to the office by 9. And at 9 o'clock, I see, usually what I do is that I'm there till about 6 o'clock, so about 10 hours. I usually see about 7 to 8 new patients in that time, and about 3 or 4 patients that are follow-up. So whether I've operated on 6 weeks ago or a week ago, I quickly see to make sure they're okay. And I also do a little bit of injecting as well. So I probably do, in the afternoon, I usually do between 3 and 5 o'clock of just injecting. So I inject patients in that time. So that's a typical consult day. And on the operating day, which are 3 days a week, consults are twice a week, I pretty much just operate from 8 o'clock in the morning to probably averages till 6 o'clock at night, sometimes later depending on the time of year. And those operation days really depend on what I'm doing. Sometimes, like I said, I do a full face neck lift that can take 6 or 7 hours, and that's the only operation I'll do that day. Otherwise, I'll do 2 short facelifts, short scar facelifts, or I'll do 2 rhinoplasties. Or like next week, for example, on Monday, I think I'm doing a Brazilian butt lift and a rhinoplasty. And then the following day, I think I'm doing a blepharoplasty and a facelift. So just to give you an idea of what I'm doing on an operating day.
Fantastic. That Brazilian butt lift that you mentioned there, that's become a really popular treatment in the spotlight recently, hasn't it?
Look, it's definitely been in the spotlight for the last 2-3 years. And it's probably, you know, purely linked to social media. There's no doubt about it. With Nicki Minaj, Kim Kardashian. I mean, even yesterday I got a question on Instagram about, you know, how do I get a Kim K look on my buttock? You know, so it's like, it's definitely trending because of that. Like when we say popular, it's not, you know, it's not like breast augmentation or liposuction or rhinoplasty. Like we probably, like 3-4 years ago, we'd maybe get 1 inquiry a month, whereas now we're probably getting 3 or 4 inquiries a week. So it's a lot more, there's a lot more inquiries about it, but actually people having surgery, it's definitely trended up, but it's still, if you look at all the plastic surgery procedures, it's probably in the top 20, so it's not in a top 5 or anything like that. But in North America, it certainly is in a top 5 because they've got more of a South American population that want a bigger waist or a bigger buttock area. And this is reflected by a lot of the conferences in America over the last 2 years, which actually have a Brazilian butt lift day, which is dedicated just to that surgery.
Wow.
So yeah, so it's definitely trended up a lot for the last 2 or 3 years.
We'll be back with more from Dr. Jack Zoumaras after this short message from our sponsors. Are you looking for a professional skincare brand that doesn't sell online? Dermatonics is a scientifically developed, clinic-based brand packed with natural actives and made free from harsh chemicals. Talk directly with their founder and formulator about how Dermatonics can help your clients' concerns and support your business. Head to www.dermatonics.com.au and fill out their stockist inquiry form for more information. Do you have to be careful when treating to be mindful that something is a trend and that it could pass?
Yeah, absolutely. And that's what comes down to the consultation. Like when I see patients, I try and work out why they want it done. The biggest question that I ask patients is why they're having the surgery done. So if it's a facelift or if it's a rhinoplasty or if it's a Brazilian butt lift, like why they're having it done is that they don't like their profile in a selfie, or they've just not liked their nose for a long time. And that's a lot deeper than it's just because I didn't like it in the selfie. Same as with the buttock, like you say, like if they're like South American background, like I mean, South Americans have always liked a bigger derriere, if you like. So I think that's probably, you know, understandable. Whereas I have seen some Caucasian girls, which naturally, I mean, in the 90s, people wanted to have like no buttock at all. So that's how much it's changed. So you definitely have to be mindful of that. So if I suspect that they're not really, you know, sold on the idea, then I do see them again. I make sure they understand, especially if they're in their early 20s, that it's sometimes not possible to reverse. Like if you're using a buttock implant for a Brazilian butt lift in someone that's really thin and hasn't got their own fat to transfer, then that can be reversed. You just take the implant out. But when you're injecting fat, that can be semi-permanent. And that's a big issue. So that's something that you definitely have to educate the patient. And that's what it's about, seeing the patient twice, making sure they're comfortable with the decision they're about to embark on.
Yeah, absolutely. Something you touch base on there, and I guess a lot of our audience who are therapists who are listening would definitely feel the same about, is in consultation, clients opening up, and it's more of a deeper emotional issue. You know, why are you having plastic surgeon today? Or, you know, why do you want to change your aging or your pigmentation, for example? Do you find that sometimes you need a little moment at the end of the day to just kind of stop and ground yourself or center yourself, I guess, from all of the emotion that can come out of those consultations?
Oh, absolutely. Like there's no doubt about it. Like when I operate, it's basically a physical tiredness of standing up and sometimes just concentrating on the operation. But with consulting, absolutely, it's like a mental tiredness of you do, because sometimes you do elicit a lot of emotion. And sometimes it's a good thing to do that, because you can basically try and help the patient, either direct them to a psychologist or actually they might not therefore need surgery, because the reason why they're having it is they're trying to hide something else in their life. So, and that can definitely take a toll, because you're listening as a practitioner, and also offering some counseling when you do that. So it can definitely take a lot out of you emotionally. So there's no doubt about that. Sometimes I have to take that moment after each patient and take 10 minutes before I see the next patient, or I'm sure your therapist would see the same thing in terms of having just a mental break even between clients, because I think sometimes you definitely need that. Because, you know, someone can't just tell you their whole life story, or maybe an emotional trauma that they've had, whether it's physical or emotional. And it's hard to, like, you know, just keep going with what you're doing after that.
Yeah, absolutely. In terms of keeping going, you said there one of your treatments could take 6 or 8 hours. How do you concentrate for that long amount of period of time? You know, I've heard people complain to me about doing a 5-hour spa package, for example. You have to be so conscious every single move you make. How do you keep that mindfulness?
Yeah, it is. It's definitely, when I do that operation, I usually like doing it on a Monday or a Wednesday, so earlier in the week rather than later in the week. So you're fresher. But there's no doubt, and that operation, 6 to 8 hours, which is the ultimate face neck lift, every step, it does take a lot of mental concentration and you know, a lot of pressure. So there's not a lot of downtime doing the surgery. But, you know, there are moments during the surgery where you can relax a little bit more, like when you're just simply suturing, even though suturing is probably one of the most critical aspects of the operation, because, you know, that's something every plastic surgeon does with their eyes closed. It's relatively straightforward. And that takes about an hour and a half to 2 hours. So there's that aspect towards the end where it's pretty much, it's all done and you can relax a little bit. But you're absolutely right. It does take a lot of mental energy. And that's why after that sort of operation, I simply just don't do another operation, because I'm just mentally and physically done for that day.
Yeah, and fairly so.
Yeah.
I heard you mention, when I did hear you speak on the Ali Lucas boat a couple of years ago, that skin therapist and surgeon should have a collaborative approach to treating a patient. As skin therapist, how can we assist you to gain the best outcome from a procedure?
Yeah, and I totally stand by that, Mark. I think it definitely is a collaborative process, because, as I've said many times, and I know it's a crude example, like I can reconstruct or basically make someone look fresher, younger by lifting their face or operating on their eyelid structure, but you still got to take care of the skin. And granted, when you do lift the face, you do tighten the skin simply because you're making the face tighter and you're injecting fat grafts, which just have a good effect on the skin. You still need to maintain the skin. So there's a lot of aftercare that you need to do for a skin, much like if you get a nice car, you've got to keep it washed and polished. So you're going to maintain that skin. And also critically beforehand, ideally, so I mean, most people that have a facelift see me and then have their facelift after 8 to 10 weeks, usually on average. Some people do inquire about it. They talk to me on social media for 6 months and then they come and see me and I want it done next week. And you don't have a lot of time to help their skin. But it's ideally great to be on a good skincare regime before the surgery, because that will actually help their healing as well, because it will actually make their skin more hydrated. It will actually balance their skin from a blemish point of view, and it will actually improve their result as well. So I think it's critical to work together for pre-op and post-op. But if you can't do it pre-op because sometimes the logistics don't work, then definitely post-op skincare is critical.
Yeah, fantastic. And is that one of the reasons why you did open the Medi Spa branch of your practice?
Yeah, that's the exact reason why. Like, it's basically to allow patients that then, if they're about to have surgery and we've got a decent amount of time, even if it's just 2 weeks, you can still do 2 weeks of good skincare to enable them to have the best possible skin before surgery. So we offer all those patients that are about to have facial surgery the skincare option. Not all of them take it, but the majority do take the advice. And the other thing is it also allows our patients that are having injectables or other surgery an opportunity to ask about their skin and things like that, because I think it's critical. So that was definitely a driving force with having the Medi Spa, and also just to provide that skincare as well as a plastic surgeon.
Yeah, fantastic. With regards to skin treatments, for pre-care or even post-care, well, obviously post-care is more anti-inflammatory, but pre-treatment, are you wanting something like a microdermabrasion or a skin needling to start to encourage the skin's cell turnover to normalize, or are you wanting just purely hydration for the glycosaminoglycans to then encourage your wound healing process?
Look, from a short-term point of view, it's more what you said just now. So it's more just the hydration to basically allow the basically soft tissue matrix of the skin to then be able to heal better. So from a short-term point of view, I'd prefer that. But obviously, whatever you do to stimulate collagenesis is great for the skin. So whether you use micro needling or dermabrasion, as you mentioned, that's a great way of doing it as well. But from my point of view as a surgeon, it's more to get that skin hydration. But obviously doing a combination of both is the Rolls Royce. You know what I mean? So that's the ideal scenario.
Yeah, absolutely.
Every facelift we offer a radiofrequency needling as part of the facelift. We often recommend them doing it more, but we either offer it before or after the surgery, depending on the logistics, obviously, with the patient, where they're from, because we do have some out-of-town patients, so it's a bit hard for them to have the treatment, a week before or whatnot.
Yes. What is the duration of downtime in which somebody has come and seen you, had a procedure, and then the skin therapist performing a treatment? Because a lot of the time a patient will do that and they'll come into a clinic and then the therapist will go, I don't know if we can treat you.
Good question.
What's the ideal time frame?
Look, that is very difficult to answer, because obviously, as you know, everyone's skin behaves a little bit differently, and the way I'd say it is 6 weeks is definitely enough time, but it can be as early as 3 weeks if everything goes well with their healing. So it's basically a range between 3 and 6 weeks, and it really does depend on how their skin's healing before you're having an invasive treatment. And when I mean invasive treatment, it would be like needling or microdermabrasion or things like that. You can certainly use topical skin products and even do light pills, like a glycolic acid pill or something like that after 3 weeks, no problem. But anything deeper, like with needling, you really want to wait until the skin's absolutely healed. And that can be anywhere between 3 and 6 weeks. Having said that, we put everyone under a healing light, from day 3 pretty much, as soon as they come in post-op. But that's kind of non-invasive treatment to try and speed things along. So I would say average 3 to 6 weeks. Most people that have a short scar facelift, so a smaller operation or eyelid surgery, I think 3 weeks is more than enough. I think those that have big face neck lift and maybe take a little bit longer to recover, you're more looking towards a 4 to 5 week mark before you could do an invasive skin treatment.
So perhaps we call out for therapist if you are unsure and if you don't have clearance from the surgeon or the doctor, let's just call it a 6 week just in case.
Yeah, I think that's the safest thing to say. Yeah.
Yeah, fantastic. With regards to people's eating habits and their lifestyle, how can that impact the treatment that you're performing?
Look, I think it's huge. Like, I think diet and just lifestyle point of view in terms of drinking enough water, eating the right food, especially in today's society where we're eating a lot of processed food and eating on the run, I think that can make a huge difference. It's just a little 1%ers. I mean, that's what differentiates me as a facial plastic surgeon compared to a normal plastic surgeon. It's just being able to know the details in a facelift. And that's the same thing as with eating. So ensuring you're eating enough, green vegetables, green leafy vegetables, you've got a balanced diet. I think those are critical things leading up to surgery and also afterwards. Making sure that some of maybe herbal things that you are taking, you're stopping them, because some herbal treatments can thin the blood and increase bruising. So there's just things like that can help healing. There are certain foods that do help wound healing, and they are pretty much green leafy vegetables. In Australia, no one's really malnourished, so you don't necessarily need diet supplements. You just need to have a healthy diet, that's all. And what that means is pretty much just unprocessed food leading up to surgery and then after surgery. Specifically after a facelift, I do recommend a soft diet because it's difficult to chew hard things afterwards, just because of the swelling in your face. But certainly diet is a huge factor, not just for your skin health, but also post-op recovery.
Fantastic. I have 2 questions here from our audience that they have sent in previously to this recording. Number 1, do you watch any medical shows?
Yeah, I do. I've watched a lot. I've watched a lot of medical shows, and I still watch some. Yeah, absolutely. I've watched like original medical shows, like ER back in the days in the 90s, and then recent medical shows such as Botched. Obviously, I've met the guys that actually run Botched.
Fantastic.
Terry DeBro and the other guy, what's his name? Paul Nassif.
Asif,
I met
yes.
Paul Nassif recently in Miami, actually. I've watched that one. And other medical shows, House, I've seen that, which is more the kind of sitcom-like medical shows. So, yeah, the answer is yes, I do.
How hilarious. And how did you get comfortable with blood and tissue?
Yeah, great question. Look, I say this because a lot of people ask me that question, and you know what? It's a stepwise process, just like it's a stepwise process to get where you are in your business and anywhere in life. Like when I was, like I said, I always wanted to be a doctor from when I was 5 years old. So I did my high school work experience in year 10. You probably remember in year 10, you used to go for work experience for 2 weeks. And I went to a GP practice, and I remember someone come in for a blood nose, and I took him to the treatment room, and I fainted. So I was thinking, and I'm sure my mum at the time, or the GP was like, maybe you're not cut out for being a doctor. But and I remember even our first day of medical school, I was probably a little bit more used to blood then, just because I kind of always wanted to do that and seeing on TV. I remember someone fainting in our medical school class. So it does happen. And usually those doctors that don't like blood become GPs, or they become pathologists or radiologists or physicians like a cardiologist or gastroenterologist that don't necessarily see blood all day. You only really see blood, I guess, if you're a surgeon or if you're an ER doctor. That's where you see a lot of stuff. There's still some things that kind of freak you out a bit. Like I remember being on call as a plastic surgeon 4 years ago at Royal North Shore Hospital, and someone unfortunately came off the back of a trailer in the country and had their face dragged for about 1 meter or 2 meters, and their face was off, which was quite confronting to see even as a plastic surgeon. So, it is something that you kind of get used to and you're just in the zone. So, but it's something that you step up toward. It's not something, no one can be expected to go into an operating theatre and not faint the first time, but it's something from a stepwise point of view you just get used to.
Yeah, you're kind of desensitizing yourself to it as you go through the career pathway.
Exactly.
Yeah, fantastic. With regards to your Medi Spa, what do therapists have to do to be employed there?
Look, that's a great question because we're expanding this year. So if any of your audience, want to find more work or maybe they haven't got their own job yet or they're still training, then we are looking for people. So please DM me. But basically, we're just looking for someone to be like, I pride myself on, I've come from a working class family, so I pride myself on excellent customer service and not be judgmental. So that's huge for me. So it's about the experience that the patient has. and the service that we give that patient. And that's hugely important, just as important as the qualifications of being a dermal therapist or being a beautician or being a doctor or being a surgeon. So, but obviously, the expertise is huge, but also just the way you conduct yourself, being a people person and making sure that the person that you're treating at the same time, at that one time, is the only person in the world. And they feel like that they're the only person in the world at that time, because I think that's the importance of the industry that we're in and the experience that we want to give to people. Because at the end of the day, it's an experience that we're giving patients.
Not just a service. I love that. Fantastic. And Dr. Jack, where can our audience go to find out more information on yourself and all of your procedures at Artiste Plastic Surgery?
Great. So we're on Instagram just as Artiste Plastic Surgery. I've also got an Instagram for me, Dr. JZ, which pretty much just looks at what I sort of do. All of our before and afters on there, and I do some lives on there as well. Also on Facebook, Artiste Plastic Surgery, for which I do more live events once a week, and it's a Q&A live event. And also just our website, artisteplasticsurgery.com.au, has more detailed information about the procedures. And I usually, obviously I've got people managing my social media, but I'm on there probably 50% of the time. So I also communicate directly with patients on social media as well. So it's an easy way for patients that maybe aren't quite ready to come in to just ask me an informal question.
Fantastic. Thank you so much for all of your time today and your insight into the life of plastic. We really appreciate it.
No problem. Thanks for having me, Tamara. It's been a pleasure.
Wow, E, how was that? I so appreciate you joining me for today's episode. Dr. Jack makes me feel like there are more seconds, minutes, hours, and time for me to study. Those qualifications were pretty impressive, as was his passion for his craft. As always, if you have enjoyed today's episode, please follow our social media channels by typing @BeautyIndustry into Facebook and Instagram, which is how others find out about our tiny independent podcast. Until next time, stay connected.